So we're joined here today by Dr. Ranya Habash, who is Medical Director in Technology Innovation with the Bascom Palmer Eye Institute at the University of Miami. And she's also a consultant to Microsoft and Chief Medical Officer with Everbridge. Welcome.
Hi, thank you so much for having me.
It seems appropriate during this time, and especially this month with the Ophthalmology Technology Summit taking place, and you're one of the featured speakers on a telemedicine session. So we'd love to just talk to you a few minutes about that. Could you first of all talk a little bit about what are some of the current telemedicine technologies supporting the physician-patient relationship amid this pandemic?
Sure. Well, back in March, we were sort of forced to adopt telemedicine pretty quickly. And we did some of the standard things, and it was mostly used for triage of patients so that we could tell if a patient was having a serious issue and they needed to come in and be seen and risk potential exposure, or if they could just stay home and be treated. So that was kind of the first use case, but then it evolved significantly from there. And lately, we've really found a lot of ways to do telemedicine that should stick around into the future. And we're finding that it's just a better way to do medicine in general for some things.
Are we finding that this is going to be the new standard operating procedure for medicine in general, having telemedicine in this situation like this, or?
Yeah, I believe so, for sure. I mean, like I said, we have found that there are some better, smarter, faster ways to treat patients and to care for patients using virtual visits of some sort. So I think they're a great adjunct to our practices moving forward, for sure.
Using it as triage, with portions of patients, helping us sort out what can be done virtually and what can be done in person.
Yeah, there's a lot more than you think that can be done virtually. We learned the first day of medical school that 99% of the answer lies with the patient. And so, just by talking to a patient, you can very easily tell if they're having an acute symptom, if it's something concerning that they need to come in for or not. And the majority of conditions or issues require counseling and things that can be tried on the outside too. So you're minimizing their potential exposure that way also. We set up like a rapid access urgent care at Bascom Palmer. And we found these are rough statistics, but we found about 70% of the patients we could help with a telemedicine visit, just a video visit. So they had stuff like, subconjunctival hemorrhage, styes, eye traumas, conjunctivitis, floaters that had been going on for months, without any changes. Those are the types of things that we were able to sort of help while the patient stayed at home. And then we found about 30% of those had problems that, triggered an alarm bell that said this patient needs to come in sooner. And when we saw that, we were able to expedite them so that they could come in through our ER or to our clinics right away. So actually the process was beautiful for both those populations. So even the 30% that we felt we couldn't help while they were at home, we did help them because we brought them in for problems that needed to be dealt with.
Mm-hmm. And I suppose a facet of this too is just, communicating to patients or reassuring them that so they don't feel that they're being dismissed or shortchanged by not having an actual in-person visit. What are some tactics or what are some strategies that we can use in relation to telemedicine in this aspect?
Oh, I'm glad you brought that up because I've found that messaging is one of the biggest hindrances to this. When your office staff says something like, "I'm sorry, you won't be seeing Dr. Habash today," that is not true. You will be seeing me virtually, and I still will be able to do the majority of things that I need to do. And I think that patients just need to know that we would not do a telehealth visit on them if we didn't feel it could be helpful for them. And if we felt like we couldn't help them, then we would still need to bring them in, and that's fine too. But I try really hard to tell my patients, to reassure them that this is a very useful visit for me. And even if it's something that I can't tell is going on, at least we know they did need to come in and risk potential exposure anyway. So that's a very important message to send. But I'll tell you that our patients have been very happy with their visits after the fact. At first they may be a little bit tenuous. They're not sure what to expect. But then afterwards, they are so pleasantly surprised that we got to spend this much time with them, and really were able to help the majority of their problems, that our scores and our feedback have been excellent.
Mm-hmm. And do you suppose this will become a regular part then of your, your protocol, even after this is over, just making that a vital part of the whole patient encounter?
Yeah, absolutely. We have a couple of really good use cases. We have a lot of different types of virtual visits at Bascom Palmer, but there are a couple that I've been using very regularly. And one of those is like cataract counseling. So I'll have a patient, we do all the, pre-op measurements and all that. And then the follow-up is to talk to the patient about their lens options. And so sitting there and doing a counseling visit with them at home, with their family members with them, has been really amazing because they're more relaxed, and their families are able to ask questions. If their families can't be there in person, we're inviting them on the Zoom call. So it becomes like a really nice family discussion. And we can really talk about what kind of refractive outcome we want for that patient. But I'll tell you, that has been probably the biggest help possible there, because now I'm not worried about spending time in clinic because I have a million other things going on. We're able to sit there, and it's actually more personal in many senses. And that's what I hear. That's the feedback I hear from patients, is that they feel it's more personal actually than in the clinic, even when we're doing these types of discussions. Another really important thing that we've been doing is a hybrid visit, where I've been attaching a slit lamp adapter where I'm watching the entire exam virtually. So I'm seeing the technician do the slit lamp exam and talking to the patient as we go along, saying, zoom in on this or mag up on this or whatever. And then afterwards talking to the patient and going over their OCT or their IOP or whatever the case may be. But they are really pleasantly surprised by how much information we're getting, and they feel like I'm right there with them anyway.
Yeah. How do you tailor then your approach with telemedicine to the specific disease state, versus glaucoma versus cataract, or how do you tailor your approach with that?
So most of these patients are established, although I love having new patients too, because that's a really good opportunity to find out what they need from you, and then go from there. But, let's take a follow-up patient, for instance. If I'm seeing a cataract patient or glaucoma patient or whatever, I would have that initial visit with them. And then oftentimes, like, let's say a glaucoma patient, if I start a new medication, I'd want them to come in just for an IOP check in about 6 weeks. But they don't need the entire, showboat visit at that point. They just need to come in, get their pressure checked, and get out. And that's a very quick, easy visit for them. So that's a perfect example of a hybrid visit where they would come in and get one targeted test, and then I would call them later to go over everything. So in the comfort of their own homes. So that's a really good, example of that, where you see the patient, you kind of see what kind of tests or information you need, and then you bring them back for that in a very sort of targeted manner, where they just get the testing and get out, and then you get to do the counseling visit afterwards.
Okay. I mean, it's really interesting. And some may say too that an unexpected byproduct of this whole pandemic is innovation that we're seeing, and perhaps it's even advanced telemedicine 15 years into the future. Do you agree?
Oh, yeah, for sure. The way I got into this whole thing was I started a company about 6 years ago for telemedicine. And it's because I was trying to help a patient while I was in clinic. The patient was in the ER, and the ER doctor and I were communicating around this patient. But we were communicating non-compliantly because we didn't have anything better at the time. So we got in trouble by the compliance officer at the hospital. And it sort of prompted me to say, well, listen, and there needs to be a better way for physicians to communicate about a patient and to do, a virtual visit to save a patient time and effort, and to make a quick decision about a patient so they're not waiting all this whole length of time. And also to help the ER doctor so he can move on to the next patient, and to help me because I had clinic patients too. So basically I found a need for better communication and virtual care. So started a company that was basically like iMessage and FaceTime, but HIPAA compliant. It was 6 years ago. It was called HIPAA Chat.
Oh,
And we put it on the App Store and Google Play. It went sort of viral from there and then was acquired by a global communications company, for which I still work. So that was 6 years ago, and it's taken this long for everything to sort of catch on, the rest of the world to catch on to the importance of telemedicine.
yeah. Well, that's awesome. So I imagine with your experience with that, you probably have some solutions and capabilities in mind that could be offered by telemedicine that physicians may not even be aware of or even thinking of right now. Like what might be some of those options?
Yeah, so great, great question again. So one of those very important things is the hybrid visits, like I was talking about. So now a patient doesn't have to wait to see me in Miami at Bascom. They can basically go to any location and we can do a hybrid visit from any location. So it's
Mhm.
so much more convenient for them. And on any day, at any time, I don't have to be in clinic for them to do that, because now they can just do the testing portion and then we can do the virtual portion from anywhere. So that has really opened up our schedules quite a bit. And, it becomes like a hospital without walls then. So we're able to see patients after hours, on the weekends, whenever it's most convenient for them and in the location that's most convenient for them.
Mhm.
So that's one thing that's really been very helpful and which will absolutely stick around after the pandemic is over. And
Mhm.
then the other thing that we've been doing a lot of is, second opinion consults and seeing patients internationally. So these patients can't really travel. And so we're reviewing medical records and doing virtual opinions with them. And it has been invaluable for them. I mean, often we get so many patients at Bascom who come from all over the world. They spent all this money and time waiting for an appointment. They've taken time off work, gotten hotel rooms, flown over. And many, many times it's something that we really could have treated or helped them with just by reviewing medical records and giving them some direction in their home countries. And so that's really been another great avenue for us recently, that we've really picked up our international visits and been able to help patients all over the world.
Mhm. And so what might be some areas where there's an unmet need where development still could be, put into place, whether it's, the lighting or the imaging or, just security of patient data, anything like that. So what are some of those areas?
I think there's definitely room for growth in the remote home monitoring department, and it's getting there. We have already several options for IOP checks and home OCT, or home OCT not quite yet, but it's in the works. So those are the types of things that would really benefit us moving forward. If we had a way to skip that hybrid portion of the visit and have a patient do continuous monitoring from home, or IOP checks or something like that from home, and then get us the information with an Internet of Things type of solution that alerts us if there's a number that's out of range or something that's out of range. I think that is the next horizon for telemedicine.
Mhm. And I guess, I mean, it's a great answer. It's really great. And I was thinking like, well, okay, so let's look at some of the older population, maybe who may not be as tech savvy or, as easily able to navigate telemedicine. Like, what are some pearls for helping those patients, navigate their appointment or experience through telemedicine?
Yeah, another really good question. I mean, there's definitely room for improvement in the technology to make it a little bit less cumbersome to use. I find that there are a couple of telemedicine companies like Doximity, for example,
Mhm.
where they just send the patient a link and there's no app to download or anything like that. So that is literally the easiest thing for a patient to do. And it doesn't matter what age you are or where you are, you just click the link and you're connected to your doctor. So I think as technology improves and more platforms go to that kind of a link without an app, I think that that's going to be a big improvement. The other thing that we do at Bascom is we have a lot of redundancy in getting patients set up. So they have, their first experiences with our scheduling department, who sets them up the first time. And then our patient access people call them to confirm and make sure they're set up and know how to use everything. They have the app downloaded, etc. And then we have our technicians on the day of the appointment, making sure that they've got the patient on video for us, like 15 minutes before the appointment time. So everything is set up. A lot of the disasters occur when the doctors try to do stuff themselves and then they end up troubleshooting with the patient about pop-up blockers for half an hour rather than they're doing their work. And so it really is helpful to use your staff to sort of grease the wheels ahead of time and to get the patients all set up for you.
So yeah, making for a pretty seamless process there. So
Exactly.